I'm sorry, Kristen, this one starts off a little heavy like the last one. Many years ago, the oldest of 3 siblings lost her mother while in 3rd grade. 2 years later, in 5th grade, she lost her father. Both times she was in a Chicago public school system. Now, knowing there were 3 children and that they attended a public school system, do you think their guardians had enough money to send them to therapy? I can tell you they didn't, because that little girl was me. Every child deserves access to mental health resources through their school, regardless of their income, zip code, or insurance status. That's not just something I believe, it's something most of us in this room already know. Even when we've never said it out loud, I'm not just living proof of this. I've done the research and I've asked 13 of you directly what you think, because your opinion matters just as much as any report. So today I'm going to talk to you about 3 things. Why the crisis is real and urgent, why schools are the most accessible place to reach kids, and why we know it works. And then I'll tell you what you can do about it. Think about the last time you've dropped your kids off at school, or you've had siblings or little cousins that you've seen after school. Maybe they were quieter, maybe a little more tired, maybe they just felt a little off. And you thought to yourself, maybe they're just having a bad day at school. But according to a 2025 report of the American Academy of Pediatrics, nearly 40% of high school students are experiencing persisting sadness or hopelessness. Not just a bad day, but consistently. And 10% of those students already attempted suicide. This is far from a statistics. When I conducted my own survey, every single person agreed that children's mental health is a crisis in this country. Now you might be thinking, aren't there resources, therapists? And you'd be right, they do exist. But according to the Annie E. Casey Foundation, 54% of youth who needed mental health care can't access it. The resources simply aren't there for them. And that gap isn't spread evenly. Barriers to care hit hardest in low-income communities, the same communities where families can't afford the cost to private therapy to begin with. And for the kids who could reach out but don't, the most common reason is they feel like they should handle it on their own. So if kids aren't asking for help on their own, we can't build a solution that depends on them asking for it. It has to already be there, in the place they show up to every single day, whether they're feeling well or not. Schools are the strongest intervention point. That place your child's attend is school. The schools are no longer waiting for a policy to tell them to implement these resources. In a 2025 report by the Kaiser Family Foundation, 54% of schools saw an increase for demand in mental health services just last year. And when the help is already there, kids actually use it. The same report by the KFF found that 18% of students in the 2024-2025 school year used school-based mental health services. No need for mom and dad to drive them across town, it's right down the hall. Based on the survey I conducted, everyone believes schools should be responsible for providing these resources. But the demand for mental health resources is outpacing what schools can deliver. About half of public schools report they're able to effectively meet that need. That's a real gap, and that one that needs to be closed. For schools that already have resources in place, we don't have to guess whether it makes a difference. There's almost 20 years of evidence proving it does. That evidence comes from a 19-year study on what happens when schools provide mental health services by economist Ezra Goldsilver and his colleagues published in the Journal of Human Resources. They found that school-based mental health services reduce self-reported suicides by 15%. And that's not just fewer crises. That same study found that students with access to mental health in school were most likely to continue using outpatient care. It doesn't just leave them when they leave the school building, it follows them. So when we know it works, when we know it saves lives, the only question left is whether every kid deserves it, or just the ones whose income, insurance, and zip code line up correctly. That part isn't left up to chance, it's left to others. Here's what it comes down to. Nearly 40% of kids are struggling, and more than half who need it can't get it. Not because it doesn't exist, but because of where they live, what insurance their parents have, or how much it is saved up. Schools are already stepping in to help, and when they have the resources, it works. No guessing, nearly 20 years of proof. So what do we do with all this information? Talk to your child's school. Ask what mental health services are available. And if the answer is not much, ask why. When it's time to vote, check the candidates' platform about what they say about funding and school funding and mental health. because that vote will decide whether the next kid gets crisis intervention or is just told to handle it on their own. And if you can, please support organizations like National Alliance on Mental Health Illness, which directly advocates for mental health services in school. That little girl I told you about in the beginning, she got through it, but she got through it without help, and she shouldn't have had to. No kid should have to. Every child deserves a school that's ready to catch them, no exception. That's not just too much to ask, that's a bare minimum. Thank you.
Yay!